My name is Candice Johnstone. I'm a radiation oncologist and the medical director of our cancer network at Froedtert and the Medical College of Wisconsin. A radiation oncologist uses radiation or high energy X-ray beams to treat cancer. I grew up in New York on Long Island. I went to college at Harvard College in Massachusetts. After that, I went to medical school at New York University School of Medicine. And following that, I went back to Harvard to do my fellowship in radiation oncology. After completing fellowship, I was faculty at Dartmouth Medical School in Hanover, New Hampshire, and after 7 years, moved here to the Medical College of Wisconsin. My practice involves primarily treating patients with breast and lung cancer, although I also am very passionate about treating palliative patients, meaning patients who are not going to be cured of their cancer, but are in pain or have symptoms from their cancer with radiation. One of my passions is education. I like to say I have a family history of education because both my parents were teachers and instilled the importance of education in my background. And how I think about education is it's not just teaching residents and fellows and medical students, but teaching my patients about the disease they have and how we're going to approach it so that they can be fully informed and participate in their treatment decisions. One of the things that struck me as a medical student was that a professor said that patients or people prefer to get bad news from a fireman or a policeman rather than a physician. And that was horrifying to me to learn that doctors couldn't give bad news in a kind and comforting way. Nobody likes to give bad news, but I think there's a way in which we can't change what's going on with a person, but we can be kind and feel as human beings what they're going through. And that's one of my goals in taking care of people with cancer. One of the things I really love about my practice at Froedtert and the Medical College in the Cancer Network, both in my practice at Froedtert and my practice at St. Joseph's Hospital in West Bend, is the team approach. We have highly specialized oncologists that really care for patients and know how to communicate with one another, which always improves the quality of patients' care. People often ask me how I take care of people with cancer day in and day out and whether it makes me sad. And yes, there are times when it's very sad taking care of people with cancer, but what gets me through each day is the people that I do help, because there are opportunities for cure or comfort in cancer treatment. And it really is a privilege to work with people with cancer, and it's why I get up every day in the morning and come to work.